And if you are not speaking, if you could please mute so we don't have any background noise, that'll be helpful for us all following the conversation.
Claudio, I'll make a motion to add public comments to today's agenda.
Thank you, Deputy Commissioner Terranova.
Second.
And I have Aisha. Thank you so much for seconding. If there's no objections, so ordered. All right. The next item is just to formally take attendance of our group here today. So for that, I'll turn to Melissa Morton. If you'd please call the roll.
Or Gualtieri.
Yes, here.
And yes, Suchitra Krishnansan. Deputy Commissioner Jody Terranova.
Here.
Aisha.
Here.
Ann Foley.
I'm here.
Tony.
Here. Can you hear me?
I can hear you. Thank you.
Okay.
Parisa Charmchi Goodwin.
Here.
Matthew Jinsky.
Here.
Andrew Milner. Herb Boris. Trisha Orozco.
I am here. I'm so sorry. I'm in a school and they're announcing things right now.
From Michael Rao. Representative Cindy Harrison.
I'm here. Thank you. Can you hear me?
And
Okay,
I
thank
can
you.
hear you. Thank you. And I think Chiefra just joined us. Are you here, Chiefra?
Hello, I'm here.
Great. Thank you. Claudia.
All right, so I think that confirms that we do have quorum for today's meeting. Appreciate that. And that brings us to the next item for the agenda today, which is in advance of today's meeting, everyone should have received the minutes from our last board meeting of June 21st. I hope that everyone has had a chance to review those minutes. I would now entertain a motion to accept the approval of those minutes.
So moved.
Thank you. Ann Foley moved. Do I have a second?
Second.
Representative Harrison, thank you for seconding. Is there any discussion on the minutes? Any changes, amendments requested to the minutes? If not, shall we take a voice vote to approve? All those in favor of approval on the minutes, please signal by saying aye. Aye.
Aye.
Any opposed? Abstentions? Seeing none, the
I
minutes are
did not
approved.
attend the meeting last time, so
Oh, yes, you were abroad doing some great presentations. We were sorry to miss you. Thank you. We will so reflect that as an abstention.
thank you.
Great. So moving to item number 3, I just want to outline some of the goals of today's meeting. At our first meeting, one of the things that became clear is we wanted to have a more defined role and expectations for what the board's function is. What are roles that are mandatory obligations of the board and the process for approving and making recommendations for allotting the Tobacco and Health Trust Fund money, and then what are some voluntary engagement opportunities that board members could choose to elect to participate in if they want to be more involved in the process of grant making, RFP review, and seeing through on the implementation, following up on the projects that we do fund through this board. So we thought it would be helpful to have this foundational meeting to talk through those statutory roles and the authority and some voluntary engagement opportunities that our good friends at DPH have been able to identify. We'll also provide a brief overview of the different state agencies that have a role in supporting the work of the Tobacco and Health Trust Fund Board. The role that the legislature plays, I think that was one my colleague Ann Foley had brought up, just refining us in our thinking of the legislative's role in formalizing the recommendations of this board's work. And I think given the statutory change that we reflect the CDC guidelines and best practices, we thought it would be helpful to have DPH do a quick review of the CDC guidelines. At the end of the meeting, it is my hope that members will more fully understand the scope of the responsibilities and the importance of the work that we're doing together, and have enough information to bring your ideas, engagement, and discussion to vote on priority areas and funding allocations at our next board meeting. So to kick us off on a review of the statutory charge and key roles, I'd like to ask Melissa Morton if you'd go ahead and take over on the presentation of that piece of our agenda.
Yes, absolutely. I'm going to just share my screen for everybody. So as Claudia said, we heard loud and clear that people thought it would be helpful to have a quick overview of the role of the board and the statutory charges versus what are some opportunities that are in addition to statutory charge or board members can be involved. So this is the slide that was on our June meeting that reviews the Public Act. Public Act 2218, Section 96 and 97 serve to actually establish the Tobacco and Health Trust Fund by allocating a transfer of $12 million of tobacco settlement funds into the Tobacco and Health Trust Fund. That was a assumption of funding the Tobacco and Health Trust Fund since a pause back in 2017. Then Public Act 2392 was passed last session, and that again authorized a deposit of $12 million in fiscal years 24 and 25. It also made some additional changes. It required the DMIS commissioner to submit a report to the trust fund starting on September 1st, 2024, and annually thereafter, detailing the dual settlement were going to be dispersed in the prior year. Then Section 4 of the statute goes on to make language revisions that strengthens the trust fund's commitment and focus on tobacco and smoking education and cessation. It updated the statute by adding vaping. It specified the board support and encourage the development of programs that use evidence-based practices, which was something that we heard loud and clear from the advocacy groups, that was an important add. Defines term limits to trust fund board members of 3 years to serve until successors appointed. And then it goes on to require that the board report biannually to the General Assembly on measurable outcomes and evaluation criteria. And that's going to be important when we get into a discussion on budgeting. So the statute defines exactly what the purpose of the trust fund is. And I know you can all read, but I think it's important to just read out loud so we're on the same page. So it states that the purpose of the trust fund shall be to create a continuing significant source of funds to support and encourage development of programs to reduce tobacco and nicotine use through prevention, education, and cessation programs that use evidence-based practices regarding. And then it lists 5 things aligned with the CDC guidelines and best practices that we sent to you in preparation for this meeting. So it says that our best practices should be regarding state and community interventions, communication methods to disseminate health information to a wide audience, cessation interventions, surveillance and evaluation, and infrastructure administration and management. So the trust fund shall be used to support the reduction use of all tobacco and nicotine products, including but not limited to combustible, non-combustible, electronic and synthetic tobacco and nicotine products. So again, these 5 categories I read align with CDC best practices. The statute then further goes on, defining the purpose of the trust fund itself, and further provides guidance on funding priorities for the board making decisions on how to utilize its funds. So we have to keep in mind with both the purpose that the funds as well as the priorities for fund allocation. So section 4D1 states the board's recommendations shall give priority to comprehensive tobacco and nicotine control programs for prevention of initial tobacco and nicotine product use among youth and young adults, smoking cessation directed at adults and youth, elimination of exposure to secondhand smoke and aerosol, identification and elimination of tobacco and nicotine related disparities, and consideration to the availability of matching funds, and recommended disbursements from the trust shall be in addition to any resources that would otherwise be appropriated by the state for such purpose programs. Again, these are funding priorities. So if programs come in that are prioritized in these categories, that's the priority, but it's not a mandate that these are the only categories that the board can consider. So I thought that it might be helpful to see side by side the 2 main parts of statute that really give the board its direction and its charge. What it looks like under section 4A for the purpose of the fund, what the fund is supposed to accomplish. And so we're supposed to accomplish things aligned with CDC guidelines for smoking and tobacco cessation and prevention, and then also taking out where the board's fund priorities are supposed to be, priority areas. But again, these 2 work in tandem. So although the purpose of the fund is to fund things under these 5 categories, state and community interventions, etc., the priority of what gets funded. We have our markers, but we can also add additional priority that the board may see fit to fund. So what's the role of board members based on these parts of the statute? So board members play some very critical roles. They determine whether funding should be provided to additional categories beyond the statutorily required priority area. So we have to, again, remain in the CDC guidelines specified in PA 2037 section 4A, but we can add to the priority areas listed should you wish. And then the board has to vote on what those additional funding categories would be. So you have a discussion, and there'd be a vote. Once the funding categories are set, or those, in addition to the priority is, vote on the allocation of trust fund dollars for each category. And then the percent allocations, there were percent allocations provided in the CDC best practices that were circulated prior to the meeting and that DPH presented on at the last meeting. CDC does make recommendations as to what percent of any state's total allotted funding should go towards the various 5 CDC categories for tobacco prevention and cessation. But those
And Melissa, if I could just I just want to
yeah.
interrupt for 1 second because I think there may be some feedback from your line. I don't know if you may want to try to go off video to provide for a more stable connection so we can hear you. You're giving such good information, and this is a critical part. I want to make sure that our board members are hearing it clearly.
Okay, I'm so sorry. Is that any better?
A little bit.
Not really. A little bit,
You're not on VPN, are you,
Um,
by chance?
not.
Okay.
I'm sorry. Should I can try to, I'll try very quickly, and then if anyone can't understand me, perhaps Claudio, you can chime. So the allocation provided in the CDC best practice can serve as a guide, but the board has the authority to set their own allocations and determine what dollars go to RFP versus sole source. So we can actually source some of the funds, in other words, determine we want a certain entity to get funded, and then we can determine how much of the dollars and under what categories should go to RFP. Send funding, once that's all decided, how much we are going to allocate each of the funding categories, we then send the funding allocation plan to the legislature for approval. So it would simply like what spoke last meeting, which is it would be our funding categories and how much of the breakdown percentage of the $12 million and what the board plans to spend percentage wise in each of the categories. The board must then spend an evaluation of the fund programs, and last time around, the board used some funding under one of the CDC categories, allotted some of the funding to go to Business Secure, a third-party evaluator who could really focus on doing thorough evaluation of all the tobacco-funded programs. And that's something that the board may wish to consider doing again. And then opportunities for involvement beyond statutory mandates also exist for board members and DPH. My DPH folks will be talking about this in the next meeting. There's plenty of opportunity. Those who want to go beyond just saying the priorities and funding categories and want to get to the nitty gritty of determining how the RFP will read or be part of scoring the RFP responses, determine which programs get funded. Board members, there will be opportunities for you as long as you don't have a conflict of interest. In other words, you're not affiliated with a group that's going to be applying for funding. You have an opportunity to participate there as well. And that would be in addition to your statutory charge. Role of the legislature. So what our allocation plan is to the legislature, they're responsible for bringing the board's proposed funding allocation down by category. And once we get that approved, then we can begin the RFP process. And then the role of state agencies. The state agencies will determine, so at the state level, will determine which state agency or agency will handle various parts of the RFP process, depending upon how the board breaks down the funding priorities. This state agencies, it had DPH in the past, lead the RFP process development through selection. But if the board, for example, says, hey, we really want to fund some sort of school-based intervention, could look at a state agency to do that. Administer and monitor contracts resulting from the RFP process or sole source, and make all the payments and evaluate programs and provide progress updates to the board. So I'm sorry I was difficult here at this time, Claudia. I turn it back over to you in case you want to field questions.
Yes, thanks, Melissa. Before we do, I'm glad we're paused here on slide 6 because that's the most important piece for our board members. If we could just go back to it, I think we moved to 7. Just to sort of reiterate what Melissa had outlined for us, the North Star of our work is around the CDC categories and buckets of investment. Those are very broad categories. I don't see those as being unnecessarily restrictive or limited in their focus. The subsequent section of the statute that creates the board and charges us with some priority investment areas are more specific types of initiatives we could take underneath the global buckets of the CDC guidelines. And that list is not an exhaustive list. So there are certain areas of priority that the legislature has pointed us to that certainly we will weigh and make sure are part of the consideration in our allocation plan. But it does allow for the flexibility that as long as it's within the broader framework of a CDC category, we do have, as the board, discretion to take initiative and start a new type of project. So if it's cessation, but we really wanted to focus on cessation in school districts and early intervention among the youngest smokers in school districts, we could point to that more targeted level of prioritization within the CDC framework of cessation programs, for example. So I didn't want us to think, I think that in the first conversation we had as a board, and I also was struggling with this, it seemed like our role was rather perfunctory, where we were just sort of taking the CDC buckets, rubber stamping them, and then calling it a day. And in fact, there's a lot more granular level of what areas of priorities do we want to put underneath those buckets? And then we need to make an affirmative decision as a board. How large do we want to make each of those subsets of investment? So each of the CDC categories will have a percentage of the 12 million distribution, and we can decide how big and small the pieces of the pie are across those CDC categories. So I think that that'll help set us up. So we have to think first on what we invest in, and then two, we have a role in saying how much. And I think it gives us an ability to prioritize on both of those levers. The second piece I think that Melissa pointed out, which is important for us to recognize, is that ultimately this allocation plan does go to the legislature for approval of the high level buckets and the categories of investment. I would equate this similarly to something like a block grant process where agencies in the executive branch put forward an allocation plan for review by the legislature. It's a similar type function here that the legislature will have. And we also wanted to point out that there will be agencies that do the RFP process. So that operational function won't be the responsibility of the board. Thankfully, we have subject matter expertise in the agencies, and we can designate how appropriate to the right agency to execute an RFP for the priority area that's within the CDC umbrella categories that are statutorily permitted. I think that summarizes some of the key points, and I'll pause if there's questions from board members or feedback on this portion of our agenda. Yes, Andrew.
Claudia, thanks so much. And Melissa, thanks so much for that presentation. Just hearkening back to prior years when we've done this work, and I suspect Anne may want to comment as well. One of the issues that we face is that even if we allocate to certain areas according to CDC guidelines and our best efforts, we may only receive our once we put out RFPs, we may only receive proposals that some of which we decide, or whomever the deciders are, decide are not worth their funding. And as a result of those RFPs, we may decide to alter our allocations based upon how good the proposals are that we receive. And so I think we need to build in at least maybe some ranges of allocation so that it gives our board and our staff some flexibility to be able to prioritize what we think the best proposals are, even if it means that we have to switch from 20% cessation to 30% cessation because we didn't get as many good prevention proposals as we thought. And then I would propose that the board in some way at least offer feedback about the proposals, because I think in the past the board has really gotten involved in at least looking at the RFPs, making any suggestions about the RFPs, hearing the proposals that are made by a short presentation by the proposer, and at least making a recommendation to the staff about what they think, which proposals they think really are worth funding. Because, the board represents a broad spectrum of people, each of whom have expertise and experience in tobacco-related and interest in tobacco-related issues. And I think the more feedback we could give to those people who ultimately select the proposals, the better. It's also a way, I think, of keeping the board engaged and involved in the work and making us proud of what we ultimately fund and report back to the legislature. So just a plea for those 2 points. One, to create ranges for the allocations, just so that if our proposals aren't so good in one area or another, we'll have some flexibility. And number 2, that we engage ourselves in the proposals, at least from the standpoint of making recommendations.
I think that's excellent feedback. I especially appreciate the point that you make about we want to fund the highest quality projects, even if arbitrarily we've decided a prioritization around XYZ being the more focus points. We don't want to lose sight of if there's many fantastic ones that all cluster under one CDC category. Let's not lose those really innovative and exciting initiatives just because we've arbitrarily decided the bucket needs to be smaller than we've gotten great respondents for. So that's a good point. We will take back, and this is why we're having this pre-conversation, so that when we come to you next time with a straw proposal, we will vet and see what the statutory flexibility is for us to do a range, and that the legislature would maybe be amenable to approving a range of opportunities. Subsequently, we could also think about potentially some sort of a catch-all category, promising interventions, or innovative interventions that just are cross-cutting that we may be able to use as a flex bucket. But we'll take both those back to try to get at your really smart point there. And I agree with you on trying to bring in more voices from the board in the RFP development process. I think that DC Terra Nova will talk through some options, including potentially being part of a bidders conference. When we do an RFP, sometimes we have an opportunity for people who are writing and scoring to share back and forth with prospective bidders. So there could be inflection points in the normal course of an RFP process that I think it would be very helpful to have people on this board be actively engaged. Any other comments or questions on the statutory charge and the key roles that we just reviewed together? And seeing none, I will move to the next item, which is going to be DC Terra Nova from the Department of Public Health. Deputy Commissioner Terra Nova will review the CDC best practices and the RFP process. I think it's a nice segue. Andrew has teed up perfectly for this conversation. So take it away, DC Terra Nova.
I'm just going to briefly go over the CDC best practices. I'm sure that all of you did not read the 144-page best practice guidelines, but there was a 2 or 3 page executive summary that hopefully you had a chance to glance at, or if not, after today's conversation, that you'll go back and take a look, just to help these categories sink a little bit into your mind so that you have a better sense of what falls into these different pieces of the pie as we look to what the recommendations will be for allocations at the next meeting. So I think Claudio, called it a pie. So I tried to, give us the visual here of all of the different pieces. And what is really important to remember that as standalone categories, each of these interventions are somewhat effective, but really synergistically, they provide the most effective outcomes. And so we really need to think about strategically funding all of the categories. We can certainly make some pieces of the pie bigger and some smaller, or add in another piece of the pie if there's a different category that we want to add, but we don't want to lose sight of kind of this big picture here. And so the current recommendations from the CDC allocate, about 35% to the state and community interventions, 5% to our infrastructure and administrative support, 11% to our communication efforts, 39% to cessation interventions, and then 10% to our surveillance and evaluation. And on the next slide, I'll give you a few examples of kind of what sits in each of these categories so that you can be thinking about them. And these are really some examples of what we've funded in the past. So not things that we necessarily have to do going forward, but just to give you a sense of kind of what lives in each category. So the first being that state and community interventions, that's really where a lot of the prevention work is happening. So at the state level, we have the Match Coalition, which is collaboration of a number of advocacy groups, the American Cancer Society, the American Lung Association, the American Heart Association, and others that are really working kind of on the statewide strategic plan, do advocacy around policy for tobacco, and provide other educational opportunities. And then at the community level, this is where we do a lot of our prevention work targeted at youth. So some things with the Boys and Girls Club, community mental health affiliates did a photo voice project. We have students at Southern Connecticut State University advocating for tobacco-free policy a few years ago. They offer campus cessation services. They do peer-to-peer networks, and they actually have a program now where they go out to schools, middle schools especially, and talk to children there and teach them about the harms of tobacco. So there are a wide range of community-based activities that can occur, but those are just some of the examples of ones that have been funded in the past through the fund. The second large category is our mass reach communication. So this is our media. We know that there's a lot of evidence that reaching out through these different campaigns actually does have an impact. I actually was reading an American Academy of Pediatrics report this morning about campaigns for youth vaping and how they really have helped to decrease children starting smoking. And so we really want to make sure that we keep this on our radar. We also have seen when we advertise and promote the Quit Line, those months we have a significant number of people calling for cessation services. And so there really is a cause and effect relationship there when we are spending money on media and campaigns and reaching people, that they are taking advantage of the services that are available to them. And we've done a wide variety of different campaigns, radio, gas stations, you know, when you're pumping gas and there's something talking to you there, Facebook, other social media, and a variety of YouTube videos as well. So a lot of different ideas out there, but really an effective way to educate and also to work on the prevention as well as the cessation piece. And then specifically, we have cessation interventions. And so probably the biggest one that everyone's familiar with is the Quit Line. So we fund the Quit Line through some money from the CDC, but then also over the years, we have also used money from the trust fund to fund this. And so I would put that on your radar as something to think about moving forward for us to be able to continue running the Quit Line and funding the Quit Line. We would need to have an allocation in this category to be able to keep the Quit Line up and running. And we've really seen actually over this past year, a real increase in the number of callers and the number of callers receiving nicotine replacement for up to 8 weeks to help them quit. So that's a wonderful program that has had a lot of success. And then the last two smaller categories are the surveillance and evaluation. And so that's the piece where we are using data to inform our policy and our programs and taking a look at what we've been funding and making sure that we're spending our money wisely and that we are achieving the outcomes that we anticipated and that we want to continue to fund them, or we find that these aren't actually good uses of our funds, and so we want to fund something else. And so we need that piece there to collect the data and evaluate our progress. And then lastly is the infrastructure, administration, and management. And that's the smallest piece, but that is really important because you need the people to do the work. And so some of that is, you know, staff that is providing services, and then also those that are running the programs, running the RFP, contracting with the vendors, and other things. And so those are the 5 buckets, and those are some examples of the things to be thinking about as we move forward to the next meeting and think about the allocations that we want to make. And so there are a couple of opportunities for participation, as we've heard and as we've tried to share. There's really a couple of areas in the RFP process where members can become involved. Now, you can't be someone that might be applying for funds because we can't have any conflicts of interest, but we would very much look forward to having members involved in drafting the RFP that would go out. And in the past, we did one large RFP and then sectioned out each component so that those that are applying could say if they wanted to apply to just the communication piece or a community intervention, a prevention program, et cetera, or if they wanted to apply, to all four. The fifth one that they wouldn't apply for is the infrastructure and administrative piece. So there's room for board members to be engaged in writing that RFP before it's posted and to really include the things that we would think would be important, much like Dr. Sellner was mentioning, really getting that feedback back from the board about what we're looking for and what types of work we want people to provide. And then on the back end, when the proposals come in, we will need people to review and score them and, rank them and decide on the best proposals to fund. So again, I think that's exactly what I was hearing from Dr. Sellner, is that the board really wants to have input on who is funded. And so volunteering to be a member of the review committee and read through those proposals and score them based on a scorecard that we develop when the RFP is written. Is a great way for people to really be engaged in this whole process. And then just to review, we touched last time on the RFP timeline, and it does take a little while to get money into the hands of those providing services. And so this is just a little bit of a snapshot that shows, once we have that RFP written with everyone's input, it gets posted online. You can share it with anyone you know. And there's that opportunity, as Claudio mentioned, for proposers to submit questions. And so that can be done in a number of ways. Sometimes it's just submitting written questions. Sometimes there's bidders conferences, informational sessions. And so there's a few ways that can happen over the first month or so. And then we publish a list of answers to all of the questions that were received. And then the proposers have a couple of weeks after those answers are published to finalize their proposal and then submit it. And then that's when the members of the review committee would get together to review all of those proposals that were submitted, to score them and select who's going to be awarded. And then once that happens, there'll be a write-up of who's recommended for funding. That would go, so at DPH, that goes to the commissioner for review. Then letters go out to the awardees, letting them know that they were selected and are going to be awarded a certain amount of money. Would you like to accept it? They acknowledge if they would like to accept it or decline it. And then the start of contract negotiations can begin. And then that's its own process on its own, which can take, anywhere from probably about 75 to 100 days or so to be complete, with back and forth negotiations between the department, the contractor, the budget, the legal office, OPM, the legal office, the program. And so a lot of back and forth negotiations go on until it finally is ready to be signed, then signed by the commissioner, and then it goes to the AG's office and sometimes comes back with questions, machinations, and then back to be signed. So it can take really up to this 200-day mark from the beginning for the money to be in the hands of the contractor. But that's just a general sense so that people have clear expectations of what the steps are in the process here. So I will end there and be happy to take any questions if there are any at this time.
Thank you, DC Terranova. While others are maybe preparing their questions. Oh, Anne, you have a question. Go for it.
I do. Thank you so much. Thank you, Deputy Commissioner, for that presentation. I have a couple of concerns, I guess, maybe not questions, but I I didn't realize until the materials went out that the CDC best practices are from 2014, and 9 years seems a long time in the public health field in terms of studies, innovations, thought processes, evidence moving forward. So it does seem outdated to me. Certainly, in terms of the allocation, we have the statutory authority that this is what we need to spend on these categories, which do align with that. So, but I don't know if with your relationship with the CDC, is there a way for the state to reach out and just ask? Do you have some kind of update? Is there an update in the works? What are your thoughts? Because I just feel like, basing our decisions on a document that's 9 years old may not be the most effective or efficient way to proceed. So that's one, and then I have at least one other thing. Do you want to respond to that, or?
Sure. Yeah, no, I agree. And I thought the same thing when I saw it too. I said, oh, 2014, that's a bit outdated. But I think the one before that was 1999. So maybe they're on a 15-year cycle to update. But we can certainly reach out and see if they have any interim advice. I think I know for myself, just thinking about when I was reading it, vaping was really not on the radar there. But I think still a lot of the same strategies and the big buckets aren't going to change too much. Like, we're going to still want to spend, a certain amount of prevention work, some on media and communications, cessation services. So, I don't, even though it's old, I don't think that the big buckets themselves are probably going to change that much. But certainly we can see if they have, a draft update or any kind of interim update that they can provide. I do know some folks from the advocacy group shared that there's the health equity update, and that's a little bit more recently published. And so that might be like an interim document that we could also use to look at to help inform our decisions.
Great, thank you. I think that would be useful if there was such a thing. So, and then my second question, I guess, is that I really liked Melissa had that slide comparing our the areas that were authorized to spend in, or that we must spend in, and then our priorities. So kind of aligning those two, I thought was really, really helpful. And as I was looking at that, I thought they were quite well aligned in terms of the priorities. Included prevention, which is kind of community interventions, cessation, which is obviously aligned, eliminating disparities, which we can do through what we used to call counter marketing, I guess is called mass communications or mass outreach or something. But the one area that I was I think fairly new to me, or I just hadn't really focused on before, is eliminating exposure to secondhand smoke and secondhand vaping. So I just wanted to throw that out there that, I think we can accomplish that through all the other categories. But is there something, and I'm not aware of what kinds of efforts or programs or initiatives would directly target that. So I just wanted to throw that out there for the Department of Public Health or anybody who is an expert in this area to think about, is there something specific that we should be thinking about in that regard? Because the legislature has asked us to make that one of 4 priorities. And I just don't know how we would do that other than the other 3 categories that we will probably be funding. So just throwing that out there.
I think I'll just say that when I read that, I thought a little bit about maybe that fell under the policy realm, where it's about making places smoke free and kind of emphasizing that the social norm is to be tobacco free and to have non-smoking in all of our environments. And so I see that a little bit more of a legislative task.
That's great, and actually that is something I did want to raise, because previously we stayed away from, the tobacco board in its previous iteration stayed away from making legislative recommendations. And so maybe this time around, that's something that we should consider, because I totally agree with you, Deputy Commissioner, that it does seem a policy arena rather than a programmatic one in terms of spending money. So I think that's terrific to hear.
I think Dr. Salner has his hand up. If I could just, though, before, I think you may be shifting topics. I just want to build on what Ann said to say a couple things. One, I do think that was a unique thing, and the more I keep looking at the priority areas, it seems to me that the priorities are all encompassing. So I see it as the person who's pre-smoking, so we're trying to get them before they initiate, person who is smoking, person who impacts others who are nearby when they smoke, and a targeting around equity. So it does seem to be that the rule eventually starts to eat itself here, and I think we have broad flexibility. And to the point about secondhand smoking, I think you're right, Ann. I think to the extent that we stop people from smoking, we stop the secondary effects of people who are nearby, who are inhaling that secondhand smoke. Where I think there may be a targeted intervention is just on the mass messaging, and if we do a sustained public campaign to help parents maybe recognize the harmful impact and reinforce the message of what they're doing, externalizing the risk of their behavior on smoking to their children, it may be a more compelling message for cessation. So I could see it as a sub strategy in terms of targeting, but your point is really well taken. And with that, I'll turn to Dr. Salner.
Claudia, thanks so much. Just to respond to Ann's first question, I do believe the CDC sets a goal to refresh the guidelines every 7 years, but I think COVID got in the way of the refreshing that should have occurred in 21. So my understanding is that they're close to coming out with new guidelines. I don't know how close, but from what I hear, they're close to coming out with new guidelines. So Deputy Commissioner, I think it might be neat to reach out to them and just see how close they are and whether we could even preview what they might have.
Absolutely.
All right, very good. Which leads perfectly to the next point. I know we're running tight on time, but I did want to pause. We've already started to engage in a discussion around priority areas, but seeing, and Melissa, I don't know if you have handy, but if you could put that slide back up, or it's Deputy Commissioner Terranova, you have the CDC pie chart, which shows the breakdown as best determined by the CDC. And I just ask the members to reflect on the proportionate share, and if there's any instant reaction anyone has, we'll certainly take the feedback we have from you all here today and put it forward as a straw proposal for more discussion and deliberation next time. But I did want to at least give people a few moments to just react to the pie chart. Does anything stand out as too high, too low, underrepresented in any way, overrepresented? We'll take that feedback now. I'll also add that one thing that I would be strongly in support of, and I hope fellow board members would also see a value, is that in prior iterations of the board, under the surveillance and evaluation pie chunk there, that category, we did in the past fund independent evaluators. And I just think that's so important from collecting the evidence on what's working and what the impact and outcome is. The legislature wants to know, how is this $12 million being used? Is it the highest return on investment? I think it is in our best interest to have an independent evaluator really look and do that scrutiny along with us, and to take feedback in every iteration of this. We are fortunate now to have at least 3 tranches of money set aside. So I think that that would be a good use of monies and time. And the other piece that I would really encourage our group to be supportive of is some of the infrastructure and management. If we want a competitive process that's well procured, publicized, we're getting the most robust feedback from potential bidders and participants, I do think we need to fund that capacity, and that capacity to also move through the grant making process, the contracting piece, all of that takes efforts. And I would hate for a great idea to languish because we don't have the infrastructure to execute a contract and move something through to fruition. So I know sometimes those type of things feel like the good hygiene that you just do behind the scenes and don't get called out. But I do want to sort of make a pitch for the value I see in those two interventions particularly. Any other feedback from the board? Anne?
Yeah, thanks, Claudio. I just would go back to our priorities that the legislature set for us, and four priorities in the area of basically community interventions, cessation, and the one we talked about, eliminating secondhand smoke, which is kind of all of these. But eliminating disparities is one of the four top priorities that the legislature has asked us to make a priority in our funding. And so I would think, given this pie chart, that Mass Reach Health Communication is underfunded, because I think that's the way that you eliminate disparities. Although I suppose you could do that through community interventions too. So now as I'm saying that, I'm rethinking it, but it does seem like something a little bit more for Mass Reach Health, that communications that made it more commensurate with the cessation and community interventions might make sense. So I'll just throw that out there.
Great, and I see that you've sparked some good discussion, lots of hands in the audience. So I will go to Aisha Clark as the next hand I have up, and then Senator Tony Harp, followed by Dr. Sellner.
Thank you so much, Claudio. So my quick response would be for the surveillance and evaluation. I think it's important for us to potentially increase that. As we're talking about interventions, Doral, we need to just ensure that the programs that we are funding are actually doing the things that we're looking for them to do. And in order to have that, we need proper funding for evaluation.
Good feedback. Thank you. And Tony Harp.
Sure, thank you. Well, first of all, I agree with Anne. I think we really need to take a look at the state and community area, and also the mass communication. But so I would agree with that. But beyond that, has anyone taken a look at what has been funded in the past and the evaluation numbers so that we can see the impact of the previous way in which we selected programs and funded them? I just think it's important that maybe staff presents that. And I would like to know that the dollars, because I guess on some level, I feel some kind of way about the this fund paying for administration and management, when in fact I think that a lot of that ought to be paid for out of the general fund. That's all I have to say.
So in response to your first point, Senator Harp, about the areas of funding that have been historically invested in and what the outcomes were, we were fortunate to have in 2017, I believe, a retrospective when the trust fund was sort of dissolved in its first iteration, and there was some money left over. It has a really good breakdown of all of the funds and some of the impact, how many lives were touched, how many people used the different interventions like the quit line. We could bump that to everyone's attention again, so it's at the top of inboxes. I just think that that's just a really excellent synthesis of where we've been and could help prompt us for where we want to continue to make investments, what's worked in the past. So good point to remind us of where things have historically been and where maybe there's still gaps that we want to focus in on. So appreciate that. And then I think we can move to Dr. Sellner.
Claudia, thanks. One comment and a quick question for you and the Deputy Commissioner. In terms of the comment, I fully agree with funding surveillance and evaluation and infrastructure as you've proposed. And, you know, if it's $12 million, I think $1.2 million should be enough for surveillance and evaluation, but we should see what proposals we get back once we put that out there. I totally agree that an independent evaluation is key and important. Not that our own staff can't evaluate, but I think it's key to the credibility of the programs. In terms of Ann's comment about the disparities, I do think that it's buried in all three of the areas, and don't necessarily think that we have to change the weighting to reduce disparities, but I do think that we need to write it into the RFP for each of the areas so that the potential contractors really understand that that's an important goal of ours. The question I had for you is related to timing. If we have $12 million per year to spend and we have potentially, I'm not sure, a 2-year funding of the fund, and then the legislature and the governor will decide in terms of the next biennium what the funding might be. As Deputy Commissioner Terranova was saying, if it takes 6 months to do the contracting and it's going to take us some time to write the RFPs, let's say that we don't get it out until let's say we don't get something happening until next fiscal year, for example, which is entirely possible since it's already the middle of October. Does the funding carry over? Can we continue if a contractor says, gee, it's going to take me 2 years to do this program? Could it carry into the next biennium? Will we have the ability to make the contracts last the appropriate time period or not?
Yeah, so I may turn to Deputy Commissioner Terranova, but yes, one of the advantages here is that once the deposits are made to the trust fund, it's a non-lapsing account. So we still have some legacy projects from earlier iterations many years ago that are still sort of titrating down. They have these small little pots of money that still remain. Maybe they didn't expend all of their contracted amount. So on that front, it's when the money gets deposited that's so critical. So around April 15th, mid-April, is when deposits will go per statute into the deposit of the trust fund. Once they're in there, we do have flexibility to be able to meet those out as things materialize and as the contracts take their normal course. I don't know if Deputy Commissioner Terranova wants to add to that, but it's a very good point that I should have reminded people at the top.
Yeah, thank you, Claudio. And I think, yes, we have the ability when we are writing the contracts to write them for any length of time that we feel is appropriate. So, you know, negotiating with the contractor, if we decide that, you know, we want to fund them for 2 years because really we're going to be starting kind of this next fiscal year to fund them for the next 2 years using the money that's currently deposited into the fund, we would be able to spread that out. So that it wouldn't be like, oh, you need to spend all of your allocation within the next 6 months to stay within a certain time period.
Thank you.
And I'm recognizing, and I want to be very respectful to everyone's time who's here today, that we're a bit over. So I will try to quickly wrap up. If you'll give me the indulgence of another 5 or 6 minutes, I think we can get through the rest of the agenda and allow a couple minutes for public comment. Just really quickly, we did do a poll to try to figure out our next board meetings. I think one thing that was clear is that a majority of members preferred a 90-minute meeting. Based on the fact that an hour felt a bit rushed today, I think that that's a good place to end up. The 90 minutes is not too long, but substantive enough that we can really engage in this back and forth. We'll take that as the sort of guiding principle for operating the board with 90-minute meetings. And it seems like on the dates, we were not of one mind and not of consensus, but the best we could propose was that if people are willing to meet the fourth Wednesday of the quarter, beginning October 25th. In that case, we would have January, April, July, October cadence for the 2024 meetings. Specifically, those dates would be January 24th, April 24th, July 24th, and October 23rd, all from 10:30 in the morning till noon time. I'd ask for a vote to adopt this meeting schedule. Do I have a motion?
I'll move to adopt the schedule. Jody.
Thank you. And a second, I think I have Dr.
move
Sellner's hand was sort of up, so I'll take that as a second. All those in favor, please signal by saying aye. Aye.
Aye.
Aye.
Any opposed? Abstention? So ordered. Thank you very much. The last item I did want to get to is in recognition of some really fantastic stakeholders that have joined us today. I know we have advocates from the health and tobacco control advocacy groups, and we have our distinguished chairs of the Public Health Committee, both Senator Anwar and Representative McCarthy-Vahey were on today's call. I wanted to make sure that if during the public comment period they wanted to make any points reflecting on today's agenda and our work next time to do the allocation plans, they could do so now.
Thank you so much, Claudio. Thank you. Thank you for all that each and everyone is doing. I just will throw something on the table for people to consider in the back, and this is something not one of my priorities, but every time we're trying to reduce the access to tobacco and vaping products in the community, some of the smaller business people say this is going to just kill our businesses. And part of me was thinking that if there was a grant program to be able to create a mechanism for that there's not a sudden loss in their finances as the responsible ones amongst them do not do change their behavior and then sale patterns, maybe we can help them initially and maybe give them opportunity to make better decisions for the larger community. So I just wanted to put that, as I've heard some of the people complain and concerned that, but I thank each and everyone for what you're doing.
Thank you, Senator. I see Representative Harrison and then Representative McCarthy-Vahey.
Thank you. Just a request, if you could, after this meeting, send those meeting dates out to us so we make sure that we all get them on our calendars and we don't have conflicts, because it is so important. Thank you.
Excellent idea. Thank you. We'll do that. Representative McCarthy-Vahey.
So with apologies for the appearance and the light here, you can see why I was off camera most of the time. I want to thank you all and thank my colleagues who are Representative Harrison and Senator Anwar on this call. I will say that earlier, I think Ann was talking about policy recommendations. I would welcome policy recommendations from this group. When we think about environmental strategies, we absolutely will have to change policies at the legislative level in order to address some of these issues. And in fact, Senator Anwar's example would likely be funding that might come, even separately. It could come from the trust fund, but we also might want to look at other additional funding as well. I'm always interested in additional funding in this area. 12 million was a great start. But I also want to say that, I know we have clearly our statutory outline. Just as a parent of a teenager whose birthday is today, which is why I'm here at home dressed like this, we think about the Tobacco Trust Fund. It's set up this way because of the legal structure that we have. But when kids today talk about smoking, they're largely talking about cannabis. And so even though I'm not encouraging scope creep, I'm just suggesting that we have that frame in mind as well when we're in conversations. And I so appreciate this work.
Thank you for that invitation to give us our ideas. I think at our very first meeting, there was already ideas about how to refresh and consider some of the changes in our statutory role. And I think to the extent that some of these RFP processes allows us to engage with the community and the people most impacted by the devastation of smoking, we can maybe help inform good policy discussion. So I think that is an appropriate place as we continue to mature as a board. Where is there evidence-based solutions? Where are there gaps? And what would we point the legislature to maybe look at further, things that maybe aren't just funded, but that could be policy changes. So thank you, everyone, for a fantastic meeting. I think we got a lot accomplished, and I think we have a good foundation for our next meeting where we could really begin to approve our allocation plan and get to work with this money being out there. So the last item then is a motion for adjournment. I'll entertain such motion at this time. Tricia, thank
make the
you.
motion.
And who is going to be my second?
I'll second it.
All right, Anna's seconding it. All those in favor, signal by saying aye. Aye.
Aye.
All
Aye.
opposed. All right, we are adjourned. Have a great afternoon, everyone. Thanks so much.
Thanks, you
Bye.
too.
Bye-bye, everyone.